Dutasteride is an antiandrogenic compound that is used for the treatment of symptomatic benign prostatic hyperplasia, BPH, in adult males by inhibiting 5-alpha reductase. In this video, let's find found. What is dutasteride? What is dutasteride used for? Contraindication. What are the side effects of taking dutasteride? How does dutasteride work? How to use dutasteride? What is dutasteride? Dutasteride, sold under the brand name Avodart among others, is a medication primarily used to treat the symptoms of a benign prostatic hyperplasia, an enlarged prostate not associated with cancer. A few months may be required before benefits occur. Dutasteride was patented in 1993 by GlaxoSmithKline and was approved for medical use in 2001. In the United States and elsewhere, it is available as a generic medication. In 2018, it was the 291st most commonly prescribed medication in the U.S. with more than 1 million prescriptions. What is dutasteride? Dutasteride, sold under the brand name Avodart among others, is a medication primarily used to treat the symptoms of a benign prostatic hyperplasia, an enlarged prostate not associated with cancer. A few months may be required before benefits occur. Dutasteride was patented in 1993 by GlaxoSmithKline and was approved for medical use in 2001. In the United States and elsewhere, it is available as a generic medication. In 2018, it was the 291st most commonly prescribed medication in the U.S. with more than 1 million prescriptions. Contraindication. Women who are, or who may become pregnant should not handle the drug. Dutasteride can cause birth defects in male fetuses, specifically ambiguous genitalia and undermasculinization. Children and people with known significant hypersensitivity, e.g., serious skin reactions, angioedema, to dutasteride should not take it. Side effects. The most common side effects are chest pain or discomfort, dilated neck veins, extreme fatigue, irregular breathing, irregular heartbeat, swelling of the face, fingers, feet, or lower legs, trouble breathing, weight gain. Pharmacodynamic. Dutasteride is a synthetic 4-azasteroid compound that selectively inhibits both the type I and type II isoforms of steroid 5-alpha reductase, an intracellular enzyme that converts testosterone to 5-alpha-dihydrotestosterone, DHT. Dutasteride works by reducing levels of circulating DHT. It was also shown to reduce the size of the prostate gland, improve urinary flow, and symptoms of benign prostatic hyperplasia alone or in combination with tamsulosin. The effect of the reduction of DHT by dutasteride is dose-dependent, with the maximum effect observed within 1 to 2 weeks following initial administration. Mechanism of action. The 5-alpha reductase is a nuclear-bound steroid intracellular enzyme primarily located in the prostatic stromal cell that converts the androgen testosterone into the more active metabolite, 5-alpha-dihydrotestosterone, DHT. DHT is considered to be the primary androgen, a role in the initial development and subsequent enlargement of the prostate gland. It serves as the hormonal mediator for the hyperplasia upon accumulation within the prostate gland. DHT displays a higher affinity towards androgen receptors in the prostate gland compared to testosterone, and by acting on the androgen receptors, DHT modulates genes that are responsible for cell proliferation. Responsible for the synthesis of approximately 1/3 of circulating DHT, type I 5-alpha reductase is predominant in the sebaceous glands of most regions of skin, including the scalp and liver. The type II 5A reductase isozyme is primarily found in the prostate, seminal vesicles, epididymides, and hair follicles as well as liver, and is responsible for 2/3 of circulating DHT. Due to its dual inhibition of both isoenzymes of 5-alpha reductase, dutasteride causes a near-complete suppression of DHT. By forming a stable complex both type II and type II 5-alpha reductase, Dutasteride inhibits its enzymatic action of converting testosterone to 5-alpha-dihydrotestosterone, DHT, which is the androgen primarily responsible for the initial development and subsequent enlargement of the prostate gland. It is proposed that DHT is the principal gene responsible for prostatic growth in later life, normal masculinization of the external genitalia, and maturation of the prostate gland during development. Thus, reducing the serum DHT levels results in reduced prostatic volume and increased epithelial apoptosis. Dutasteride is a competitive and specific inhibitor of both 1 and type 2,5-alpha reductase isoenzymes, and when evaluated under in vitro and in vivo conditions, the dissociation of the drug from the drug enzyme complex is reported to be extremely slow. Half-life. The terminal elimination half-life of dutasteride is approximately 5 weeks at steady state. This long half-life accounts for the serum concentrations remaining detectable for up to 4 to 6 months after discontinuation of treatment. Dose. Benign prostatic hyperplasia. 0.5 mg POQ/day. Safety advice. Dutasteride is teratogenic and as pregnancy category X, women who are or may be pregnant should not handle dutasteride, Avodart, because of the possibility of percutaneous absorption and teratogenicity to a male fetus. That's all the information about dutasteride we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.